Hi, and welcome to another Memorial Hermann Facebook Live. I'm Evan Koch, and I'm here today at the Memorial Hermann Texas Medical Center to talk about a subject important to everyone, and that's sleep. And joining me is Dr. Richard Castriata. He's the medical director of the Sleep Disorders Center here at Memorial Hermann Texas Medical Center, and he's also the director of pulmonary and sleep medicine and a professor of medicine and pediatrics at the University of Texas Health Science Center at Houston McGovern Medical School. Dr. Castriata, thank you so much for joining us. I want to jump right into it and talk in just how many hours of sleep should on average an adult have?
It's a good question, and the answer is very simple and well documented. 7 to 8 hours of sleep is the actual normal amount of sleep that we should be getting in a 24-hour period. And for normal individuals, less than 6 hours is usually accompanied by deficits in functioning during the day.
So does that suggested amount of time change for teenagers?
Absolutely. Teenagers, believe it or not, need at least 9 hours of sleep. If you took a bunch, and they actually did this with a study done in Rhode Island, they took a bunch of teenagers and stuck them all into an area where they controlled their sleep and their wake and just let them alone. And they averaged 9.25 hours of sleep if they were just left alone.
Mm-hmm.
But the requirement is at least 9 hours of sleep for teenagers, adolescents, 10 hours of sleep for middle school students, 11 hours for elementary school students. So a lot more sleep than people think.
So you talked about not enough sleep and deficits. What type of deficits are there when you don't get enough sleep? Typically?
If you don't get enough sleep, what's hampered is your memory capacity, your ability to learn new things, your judgment, your executive judgment, being able to figure things out, tasks, being able to react quickly. For example, there are good studies that show that if you are sleep deprived and driving, you make little mistakes and miss things that can lead and have led in real life to catastrophic accidents. So that's the reason why it's especially important for people driving and operating dangerous machinery to have enough sleep. And in some states, driving without enough sleep is the equivalent, by law, is equivalent to driving while intoxicated and could be punishable the same way.
Wow. So what about for those people who say, I don't need a lot of sleep? Are there really people who really don't need a lot of sleep, or are they just thinking, no, I can make it on 4 or 5 hours of sleep, I'm okay?
That's another really good question. Well, the answer is yes, there are. There are genetic short sleepers, and these people, we have the genes that we could actually control for this. There are some people who run in families who literally don't need as much sleep as everybody else. And there are genetic long sleepers who would function normally if they got 10 hours sleep a night, but functioning on 8 hours, they don't do well. So there do exist genetic short sleepers and genetic long sleepers. These genetic mutations, however, and that's what we're talking about, mutants, really, are rare. They're not all that common. And more common is the misperception that one can do well, because oftentimes if you're driven, you really need to get up and do things, and you've got that adrenaline flowing, you're pushing yourself against nature by staying up too late. There's a misperception in our culture that going without sleep is somehow macho. And people will brag, I only got 3 hours sleep last night, and look at me, I only crashed my car twice on the way to work.
Right. I felt like I could do that maybe 10, 15 years ago, and as I've aged, I felt like like you said earlier, if I get less than 6 hours of sleep, there's something off, and I definitely feel it in the afternoon a little bit more than if I had gotten the suggested 8 hours of sleep, which, by the way, never happens for me. But so I also want to take a quick second to our viewers and invite you to ask questions in the comments section, because this is a subject that affects everyone, and I'm sure anyone who's watching right now, they're going to have questions. I have a ton of questions in front of me. I'm going to try and get to all of them, but if you have anything you want to ask, please put it in the comments section. So What are some of the typical sleep issues, the most common sleep issues that keep someone from getting adequate amounts of sleep?
Well, in just common everyday circumstances, too much caffeine. We have tons of caffeine added to soft drinks, and we have a culture where people drink a lot of coffee, tea, sodas, chocolate. There's a misperception, for example, that green tea doesn't have caffeine. It does. And a lot of things that we're not aware of have a lot of caffeine. So caffeine is a sleep killer. Everybody's metabolism for caffeine is different. So some people can drink a pot of coffee at night and sleep like a baby, but others, just one cup of coffee in the morning will destroy their sleep all night. So caffeine's a major sleep disruptor. And a lot of medications cause insomnia and sleep disruption. So those are probably the most common ones. There are sleep disorders, however, which are quite serious, that result in the disruption of sleep, so that people can't perform well during the day, even though they've slept for 8 or 9 hours. So the most common of that, of course, is obstructive sleep apnea. Very common, widespread in the population, and this is one disorder in which people stop breathing at night because the airway becomes occluded, and that sleep disruption results in a decrement in daytime performance. All the things I said before about inadequate sleep will be true for somebody with sleep apnea, even if they have slept, because each hour of sleep is disrupted by the inability to breathe.
Right, so their 8 hours of sleep might really only be about 3 hours of good sleep,
And
just for example,
less, right?
Probably less than that. So we talk about sleep disruptions. What about disruptions that aren't sleep apnea, like, hey, a new parent with...
Absolutely. This is something which there's a normal adaptation that we have to the environment. So that a new baby, that's an excellent example. The same thing can happen when soldiers are out in Afghanistan. That during the night, even small signals that ordinarily would be filtered out of our input during sleep, we wouldn't notice. Even small things all of a sudden would prime to actually wake up, judge, is that noise the baby? Is it something I have to do something about? And we're primed to do that. That's normal and physiologic for as long as you have the baby or a sick relative in the house or something that's going on. But for some people, this reaction persists long after the need. We call that persistent psychophysiological insomnia. It's very, very common. One of the most common causes of insomnia in the adult population, actually in all populations, but particularly the adult population, where people have learned to sleep poorly, and it might be persisting because of a baby in the house or of his sickness, or something else that's going on, a divorce, a worry, taxes, where people start worrying at night about what should go on, and they can't stop doing it. And that, again, like caffeine, will destroy sleep because you're always primed. That priming causes the release of mediators like adrenaline and cortisol in the middle of the night to wake up and judge if there needs to be something done. And once you're awake, it's awake forever.
Very interesting. So we're talking about caffeine possibly affecting sleep. We're talking about your thoughts. I wouldn't say environmental concerns. What about the effects of a stimulant like tobacco on sleep and nicotine?
Now that's another good guess. Tobacco, nicotine's a stimulant as well. So whether that nicotine is delivered from an e-cigarette or whether it's delivered from a regular tobacco cigarette or chewing tobacco, it's still going to be the same. And like caffeine, nicotine will be a major factor in sleep disruption. So yeah, that's another problem.
And here, I guess this is
alcohol. Is the next one. Alcohol has sort of a biphasic metabolism. The first phase, alcohol is metabolized and it actually causes us to go to sleep earlier than normal, makes us drowsy. The second phase, it's a stimulant. So we wake up in the middle of the
Mm-hmm.
night and can't get back to sleep. So alcohol near bedtime may in fact also be a disruptor of sleep.
Another environmental factor that I feel may get overlooked and may not in your eyes, screen time. Looking at our phones, whether it's the TV, your laptop, your mobile device, does that have an impact on whether or not you're able to get to sleep?
Absolutely, absolutely. We control our sleep-wake cycle, our circadian rhythm, with a couple of factors. One factor is just the longer we're awake, the sleepier we get.
Mm-hmm.
The other is a circadian rhythm that depends upon entrainment with the light-dark cycle.
Mm-hmm.
The light-dark cycle, we have a master clock deep inside our brain that receives signals through the eyes, through special receptors other than the rods and cones that are specifically set for blue light, the frequency of
Mm-hmm.
blue light. That blue light signal tells the brain it's time to wake up, time to function
Mm-hmm.
optimally. It's summertime, it's daytime.
Mm-hmm.
And when we have that same, even low level blue light
Mm-hmm.
during what should be our sleep time, then it's continuous. It would be the same thing as having bright sunshine shining down on top of you
Mm-hmm.
in the middle of the day, telling your brain it's daytime, you have to wake up, it's daytime, you have to wake up, except it's 2 o'clock in the morning. And
Mm-hmm.
you're looking at one of the devices that has got the blue background. So it may be a
Mm-hmm.
cell phone, it may be a tablet, it may be a computer, it may be a
Mm-hmm.
television screen. All of those things with the electronic devices with the blue background are telling the brain to wake up.
Mm. So we've talked about all these factors, and some of the the caffeine, the nicotine, those are addictive or can be addictive.
Well, they are addictive.
They are addictive.
Caffeine, nicotine, and alcohol can all be.
Right.
Alcohol is not addictive to most people. You have to have a
Mhm.
genetic predisposition for it.
Mhm.
But nicotine and caffeine are addictive to everybody.
So how do we address those factors that could possibly disrupt our sleep?
Well, the first thing is to determine whether your sleep is being disrupted.
Okay.
So, I'm not a spoil sport to tell everybody you can't drink and you can't have caffeine or anything like
Mhm.
that. If you're sleeping well, then you don't. If you have those other possibilities and you're still having problems waking up in the middle of the night and having your racing thoughts, then you're probably in that ball game of psychophysiological insomnia. Probably need to talk to somebody. The best treatment for that is something called cognitive behavioral therapy
Mhm.
rather than sleeping pills.
Okay. So moving back to sleep apnea, if left untreated, what are some of the effects of sleep apnea?
That is a very good question. What happens during the sleep apneic event is our airway gets blocked off
Mm-hmm.
and our oxygen level keeps falling until it reaches a certain level during sleep that triggers the brain. It's called a hypoxic threshold. And it triggers the brain that then wakes up and turns our physiology from the sleep state with the flaccid muscles to the awake state where the muscles contract and open up the airway.
Mm-hmm.
But the effect is like somebody poking you every minute and saying, wake up and breathe, wake up and breathe. So you have constant sleep disruption. In addition, each time that there's that arousal, it's accompanied with this increase in adrenaline, norepinephrine, cortisol that raises the blood pressure. And so what happens is you get inflammation in the airways, you have sleep disruption, so you're sleepy and you never have good refreshing sleep. Your blood pressure rises during the night, and what we now know is that the only blood pressure that's important with regard to cardiovascular events is the sleep blood pressure. Office blood pressure means nothing. Daytime blood pressure means nothing. That nighttime blood pressure is what's important, and that's the blood pressure that goes up with obstructive sleep apnea. And in addition, that blood pressure goes up, there's inflammation, there are other things that put a strain on the heart, put you at risk for heart attack and stroke. About 70% of people with a stroke have sleep apnea. Very, very risky. So then, in addition to all of the physical things that put you at risk for stroke, heart attack, diabetes, uncontrolled blood sugar, then there's also the consequences of the sleep disruption. So you have a much higher risk of automobile accidents, accidents at home, accidents at work, just because even if you slept 8 hours, you're still not functioning right. You're functioning like you had 2 or 3 hours sleep.
Right. I think that's really important because you think about a good night's rest, and that's just, I think many people, myself especially, I think if I get a good night's rest, then that's the key to me having a productive day.
And it affects judgment,
right?
Especially, I had one patient who was a CEO of a company, and his only symptom, he had significant sleep apnea, and he didn't complain of sleepiness, he didn't complain of anything else. His only symptom was he was making all bad decisions now. It used to be that all his decisions were right on cue, and he was making all kinds of executive decisions that were wrong because of the sleep disruption.
And, you think it's just about production the next day, but you describe some really important health factors. So a good night's rest is extremely important to your overall health, and I don't think that everyone is that aware of what you just told us. I think that's amazing information. So we talked about some of the causes of insomnia, side effects of sleep deprivation, maybe some ways to address those sleep disruptors. And we talked about a little bit before the Facebook Live started, what is REM sleep?
Okay, REM sleep, REM, stands for rapid eye movement. And this entails a bit of an explanation. As it turns out, we exist in really 3 complete different states of being. The awake state, the regular sleep state, and the REM sleep state, each of them with their own physiology. Of these, REM sleep, rapid eye movement sleep, is the weirdest by far. That's why REM sleep is sometimes called paradoxical sleep or active sleep. In REM sleep, the body is paralyzed. The brain is at least as active as during wakefulness, with a high metabolic rate. And even though the eyes are closed, the eyes have periods, we call this phasic REM, in which there's rapid movement of the eyes. And that's what first triggered the observation that this was a different form of sleep when investigators watching their own children saw these eye movements and said, gee, this is different. Let's take a look at this a little bit closer. It's the state in which we do our normal dreaming. And there are a ton of other very strange things, some of which might not be appropriate for me to talk about today, that occur as physiologic consequences of REM sleep that we can't really explain completely. It's a strange state of being. But the physiology does entail paralysis of most of our muscles. So diaphragms work, heart works, but the rest of our muscles are, for the most part, paralyzed or greatly diminished. This is what keeps us from acting out our dreams. And so I imagine that we evolved in some way to have REM sleep and be paralyzed. Otherwise, we would have killed each other off in our dreams. And maybe that's what happened to the people that didn't have REM paralysis. Wow. I don't know. But at any rate, there does exist a disorder called REM behavior disorder, REM sleep behavior disorder, in which people aren't paralyzed during REM sleep, and they actually can act out their dreams. This is one of the sleep disorders, like sleep apnea. It's a sleep disorder which is particularly dangerous because people can do a lot of harm to themselves, to bed partners, or to other innocent people, acting out dreams. And it's a particular concern because now we know that most of those patients, if the disease is not caused by a medication or something else, eventually go on to develop a neurologic disorder, the most common of which is Parkinson's disease. Wow. The sleep latency, the time of onset for the development of those other diseases may be very long. It may be as long as 50 years, or much shorter. But it's important to identify those people that have dream enactment, to treat them, to prevent injuries, and to observe them in order to make sure that they don't go on to some other neurologic condition.
Wow. So we touched on many different types of sleep disorders, environmental factors. What can people do initially who feel they may not be getting enough sleep? What are there certain steps that they can take themselves at home and then before consulting a physician or a specialist?
Sure. I mean, some of the things I've already mentioned is just to go over the list of sleep destroyers. So caffeine, nicotine, alcohol, and medications to see if any of those are the culprit. And the easiest thing to do is just stop caffeine, or if you're drinking a lot of caffeine, slowly taper it down so you don't get withdrawal symptoms. But to slowly taper down the amount of caffeine and then see if that improves sleep. So all of those things we should do. In the evening, try to get rid of all kinds of intrusive thoughts that are worrying about, did I get this done right in the office? Do I have an exam that I have to prepare for? Did I get my tax return right, or whatever it is? Try to set aside time in the evening in which you're able to put aside all of those things and decompress. Avoid exercise in the evening, but I endorse very strongly exercise in the morning. So exercise in the morning promotes good sleep at night. Exercise in the evening gets all the wrong hormones, again, roaring around, so you're all upset, so it's harder to get to sleep if you exercise in the evening. The other things that may be helpful is to make sure that your environment allows your body to cool off during the night. So a lot of times what happens, in order to get to sleep, our core body temperature has to go down, and it's the actual change in core body temperature that is part of the development that we need of getting to sleep. So one of the things is to make sure that the environment is cool enough for us to actually have our body temperature drop during the night. That means an air conditioning in the summer, and that means in the winter not loading on, not having the temperature go up and having too many covers on. And anytime in between, just think about that. Think about, I've got to be able to cool off during the night. It can't be too hot. If I'm too hot, I'm not going to be able to sleep. Comfortable environment, comfortable mattress. Make it dark during sleep. And the best, healthiest environment is to have a bedroom window facing east so that you have the early morning sun that helps to wake you up and get you going. And you don't have the late afternoon sun that makes the bedroom hot and makes it harder to get to bed early for children if they need to get to bed before sunset. A regular bedtime, a regular sleep-wake cycle is of invaluable help. So always get up at the same time every morning, all weekend long, same thing. If your schedule is 7 in the morning, make it 7 every morning. Bouncing around with bedtimes sort of disrupts the circadian rhythm.
Sure.
Don't have a real big heavy meal at night. If you can have a good healthy meal, but not just before bedtime, and avoid alcohol at bedtime. And I guess that's about it.
So you mentioned not having too heavy of a meal at dinner. What about after dinner? When should people cut off food?
Well, you don't have to cut off food. Just have to cut off, first of all, anything that's spicy, anything that's got caffeine in it, in large caloric loads.
Okay.
But you don't have to cut off food. You just, you can still have your cheese and crackers or warm milk or whatever you want in the evening. That's
Okay.
pleasurable for you. That's not a problem. Just don't have a huge meal.
Right.
It's going to be disruptive.
Napping. Let's talk about napping.
Okay. It's another good topic because there isn't any cut and dry answers to the question should you nap or should you not nap. And most of the world naps during the day, especially in warm weather countries. Have for centuries always had a midday nap during the hottest part of the day. That's physiologic. Our bodies are actually geared towards having a daytime nap, and there's nothing wrong with it. In addition, even during the night, our concept of sleeping all night long, all through the night, is a new one. It's not, our founding fathers in the 1700s talked about a first sleep and a second sleep. They would go to bed. They always had to get up. Somebody had to get up and stoke the fire and do things, and then they'd go back to sleep again.
Okay.
So there isn't any magic about having 7 or 8 hours of solid sleep in the middle of the night. We're used to thinking about that, but it's not necessary. We need 7 or 8 hours of sleep in a 24-hour period. But if you want to have some sleep at night and take a nap during the day, it's perfectly fine. And if you want to have 2 naps, 2 periods of sleep during the night, that's perfectly fine. Long as it coincides with your daytime work, school, right?
Okay.
Then socially, there's nothing wrong with it. The middle of the day nap was gradually, even in southern countries, eliminated, mainly because in the industrial age, people would have a rush hour to get to work. You didn't want another rush hour to go home to take a nap and another rush hour to come back. So that changed. Social mores changed to eliminate that daytime nap. And the same thing for the nighttime. We evolved with central heating, and we didn't need to get up to do other things, and so we kept sleeping during the night. But these are social changes that have engineered our sleep-wake cycle. So for people who would like to have a nap and it's comfortable for them, it's okay. If, on the other hand, you want to sleep all night long and not get up and not wake up too early or have sleep disruption, and you're taking a nap during the day, then I would say, well, stop the daytime nap if you want to sleep all through the night. Because the total amount of sleep that you get is not going to change. If you're sleeping for an hour in the middle of the day, then you're going to have an hour less sleep at night. Otherwise, you would wake up spontaneously. And for most healthy people, you should wake up spontaneously without an alarm after you've had enough sleep. And that should be a regular occurrence. So if you need an alarm clock to get to sleep, it's probably a hint. If you need an alarm clock to wake up in the morning, it's probably a hint that you're not getting enough sleep. Your body needs a little bit more sleep.
What is shift work sleep disorder?
It's common. Shift work sleep disorder, or shift work disorder, is the adverse consequence of having people work at night or evening shift and either changing those shifts or working constantly at a nighttime shift that disrupts your sleep-wake body mechanisms. And this is common in the medical profession, common among doctors and nurses because we have to work all night. And it's common in industry and in things like NASA, where people have to be working 24 hours a day to keep the astronauts in the space station functioning correctly, or a mission. And there are adverse consequences to this night shift. So a study that showed that nurses who work at night have a much higher incidence of breast cancer. That's theoretically been related to the lack of melatonin because but there are many kinds of things that can be addressed, especially in the healthcare centers, but in all the work environment. And in order to avoid it, what we suggest is to maintain, again, the same sleep-wake cycle. If you're on a night shift, try to stay on a night shift even when you're not working, so don't go flipping back and forth. That blue level light that we talked about, if you have blue light in your work environment, it'll help you to be more productive and awake and stay awake. And then when you go home, there are special goggles that are made that are called blue blockers that keep the blue light up when you're driving home in the bright sunshine, so to help you to keep your sleep-wake cycle in the way it should be. I highly recommend doing that type of thing to try to maintain a sleep-wake schedule that's not shifting back and forth in order to avoid the symptoms of shift work disorder.
So we've talked about a wide range of subjects here. I think we've addressed this next question, but the importance of good sleep habits in preventive health and making sure you stay out of the doctor's office.
Yes. A good sleep-wake cycle, so that you're going to bed at the same time and getting up at the same time, have adequate sleep, and have no disruptions during sleep to raise that blood pressure, etc., will be a giant step towards a healthy life during the day as well as at night. There are lots of indications that when there's a lot of sleep disruption during the night for any of the reasons, not just for sleep-disordered breathing, but other things that can go on during the night, and that's associated with an inflammatory state, and that source of inflammation takes its wear and tear on the cardiovascular system. So overall sleep health is going to be good for overall cardiovascular health, blood pressure, and blood sugar, etc. In addition, overall adequate sleep without sleep disruption, it empowers the memory, so it empowers memory consolidation, executive decision making, insight, and the kinds of things that you would expect to have with a well-functioning brain, well-functioning mind.
So we have a couple questions here that we haven't gotten to. One of them is snoring and sleep apnea. How do I know that the snoring is not sleep apnea? Are they the same thing?
Okay. They're not the same thing. Many more people snore than have sleep apnea. And although there are some questionnaire studies of whole populations that implicate snoring with cardiovascular disease, these are all studies that were just based upon blank questionnaires and did not exclude sleep apnea or sleep-disordered breathing. In our studies here at Memorial Texas Medical Center, Memorial Hermann Texas Medical Center, we did look at people who had what we call primary snoring disorder. That means they had a complaint of snoring. We brought them into the laboratory. We determined they did not have sleep apnea. And this group of people that have just snoring did not have any higher risk of heart disease or high blood pressure than the general population. People who have sleep apnea, on the other hand, are a completely different thing, because the people that have good going sleep apnea that is associated with a high risk of heart disease and stroke, and with all the other things that I talked about. So this is a major medical problem, and they shouldn't be considered to be the same or similar. It's a much different thing. One's black, one's white. How can you tell the difference? Well, you can't tell the difference unless you do a sleep study. That's the bottom line. There are hints that for sleep apnea, if you have moderate to severe sleep apnea, there's a good chance that you're either going to have non-refreshing sleep, wake up and still feel tired, or you're going to have insomnia, that you're not able to sleep well through the night, or you're going to have excessive daytime sleepiness during the day and keep falling asleep all the time. So those are symptoms of sleep apnea. Then there is the witnessed apneas that sometimes patient bed partners may notice that there's interruptions in the snoring during the night, and sleep disruption in general. But the only way to distinguish snoring from sleep apnea is to actually do a sleep study and look and see what happens.
For those folks who have trouble getting to sleep and they take a sleep aid, how does that might help them get to sleep, but does that necessarily equate to better sleep? Is that good sleep?
It's not necessarily good sleep or better sleep. We, in general, in sleep medicine, are very conservative with regard to the application of hypnotic medications or sleep inducers or sleep aids. First off, there are very few FDA-approved drugs for hypnotics. Many of the drugs that are taken, even prescribed, are not actually approved for use as hypnotics to put people to sleep. Often the most commonly used drugs are actually used only because their side effect is to make them sleepy. So there may be an antidepressant drug that as a side effect makes you sleepy, or an allergy drug that as a side effect makes you sleepy. And here you're taking a drug because of its side effects. Doesn't make any sense. For the FDA-approved drugs, they're only approved for short-term use in insomnia. There's only one exception to that. There's only one drug that FDA has approved for long-term use, and all the others and most commonly used drugs are really only for short-term use for less than 3 months. Nothing should be used continuously. And we try as much as possible to use these sleeping pills for a very short period of time and only when necessary, and try to address the cause of the insomnia and to change it, and to put people in control of their own health without the use of medications. So we don't look now. The newer medications are much better than the years past, when people were dependent on barbiturates and highly addictive medications. So the newer medications, there are only a few. There aren't very many. But the newer, real FDA-approved sleep medications aren't addictive, and they are effective, but they're not approved for short-term use except for one. And all of them have the potential for side effects. And so we use them because every medication has its use, but we use them in low doses for prescribed periods of time while we're trying to find the underlying cause of insomnia or sleep disruption and correct that.
Great. Well, I feel like we've covered a lot of ground. We could probably spend all day talking. I know you definitely could. You could spend all day talking about that.
Absolutely.
But I just want to recap for our viewers that one, we have to pay attention to our possible sleep disruptors and address those, which would be caffeine, tobacco use, mindfulness, what we're thinking about, making sure we free our mind and reserve time to just kind of get away from our daily stresses, I guess. That a good night's sleep is important, not just to your energy and production the following day, but as you stated, it's a huge determinant of your overall health and how well you sleep. Is there anything else I'm missing? Any big takeaways for everyone at home here?
Oh, I think we've covered pretty much.
We covered it all. Well,
There are probably some other things we'll think about later.
great. Well, if there are those things that we didn't cover, I'm inviting everyone at home to please send us your questions in the comments section. We will get to them. I want to thank Dr. Castriata for taking time out of his busy schedule to come and talk to us about this here at another Memorial Hermann Facebook Live. And please, send us your questions. If you have any further questions or want more information on sleep disorders, please go to memorialhermann.org. I want to thank everyone at home for joining us. Take care.